Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe my channel and also please give your valuable comments. So we have seen many classes regarding autism, and the last class I have discussed about the management principles of autism. So today we will see the strategies. What are the different strategies that we will follow in case of autism treatment? So first strategy is ABA. ABA refers to applied behavioral analysis of the child. So this is very important, applied behavioral analysis. Why? Because each autism child is different. There is some degree of difference will be there. Okay. So in some child there may be all the symptoms, 100%, all the symptoms pertaining to the autism may be there. In some of the children there may be only 10% symptoms, 20% symptoms or 50% symptoms will be there. So accordingly, the behavior of the child will going to change. So we cannot have a fixed frame for all the autism patients because it depends how much is get affected. Okay. So therefore, each autism child is different. So plan accordingly by looking at the change in the behavior and in which domain it is more affected. Okay, sometimes the child may be there, the social domain is more affected, but language is not much affected. Sometimes language is much affected and social is not much affected. Sometimes both are get affected. Sometimes both are mildly get affected. So all these possibilities are there. This is one thing. Another is structural teaching. What do you mean by structurally teaching means plan the way to put the things. That means how you are going to approach. Okay, so that's called structural teaching. It's not haphazardly you are doing, or you have got a fixed criteria of treatment and accordingly you are doing. It is not like that. You have to do it very structurally, how much is required, where it is required. Then we have to use different developmental models. So as for the development of the child, different developmental models should be used. Similarly, we have to go for speech and language therapy. That is a very important thing because we know that child is having problem with the communication and speech, etc. So speech therapy and language therapy. So these are the very important things. Verbal and non-verbal communication of the child is get affected or is not able to do it. So therefore we have to teach it. Then social skill instruction. So we have to also teach some of the social skills. That means doing namaste or shake handing and then waving bye, etc. So these are some of the examples of social skills, and this has to be taught to the child in a very structural way. Occupational therapy is one therapy which helps the baby to be independent in the daily routine. So we are teaching there what are the daily activities that baby is doing, like toothbrushing, etc., or washing the hands, toothbrush, etc. So this comes under the purview of occupational therapy, so that accordingly the muscular movements and what are the skills, etc. So we have to teach it. Then sensory integration therapy. Child is having problem with the sensory perception, isn't it? So different sensations has to be used to give the sensory integration therapies. Okay, so basically when talk in terms of Ayurveda, that we'll discuss later. In Ayurveda, the treatment basically depends upon this particular aspect, that is sensory integration therapy. Okay, so we are giving different types of sensation to the child. It may be auditory sensation, it may be pressure sensation, it may be pain sensation, or it may be touch sensation. So which enables the baby to develop the sensory integration. Okay, that we will discuss in the future classes. Now, one of the very important aspects in the diagnosis of autism is YUM chart. Now, this has been popular now and it is commonly used also. So, YUM chart score. So, what do you mean by YUM chart scoring? So, this is used as a autistic spectrum disorders. The YUM chart scoring is used for autism spectrum disorder. Now, autism and autism spectrum disorders are different. Okay, so autism spectrum disorders include autism, Asperger syndrome, and Rett syndrome. Asperger syndrome is not exactly sharing all the symptoms of autism. Okay, actually in Asperger syndrome there is no much problem, but only problem will be there in the social communication. Okay, social communication is having some problem. Otherwise, his social developmental milestone is also normal and its language is also normal. But he has got some problem with the communication. He's well knowledge, he knows everything, but just in communication, communication for him is just like a mathematics solution. Okay, mathematical question. So he is totally blank in communication. So that we'll discuss again later. So autism spectrum disorders includes many things. Okay, but the MCHAT is used for all autism spectrum disorders, not only for autism. Now, this screening tool is applied between 15 to 30 months of the age. Now, this is one of the limitation. So, this particular MCHAT score is used only between 15 to 30 months. 30 months. That means 2.5 years. Up to 2.5 years, this is applicable. 1.5 to 2.5 years, this is applicable. Not before that and not after that. Similarly, this gives a level of risk of ASD. If the high risk is there, child should be evaluated. Now, actually, this MCHAT score is not for the diagnosis. This only indicates that what is the risk of developing autism in this child. Okay, there are so many questionnaires are there. Based on the questionnaires, so we can able to identify the risk of developing autism in this particular child or presence of autism in this child. If the moderate risk, it should be monitored, and if there is a minimum risk, it needs no any intervention. So this is usually done 18 to 24 months. Of course, the maximum time limit is 15 to 30 months. Now, this is all about MCHAT. Okay, MCHAT is it is available and commonly used for the assessment of the autism. Quite beneficial because we can understand the risk factors. How much risk is there to develop autism in future. So, thank you very much. Again, we will meet in another class. So please don't forget to subscribe my channel and also please give your valuable comments. Thank you very much.